Today's presentation is about leadership in nursing. I'm NancyL and I'm going to present about managing a conflict effectively in a clinical environment. Conflicts are inevitable when you work in a stressful environment like healthcare. It can happen anytime to anyone. It can happen inside your own nursing team or with people outside like the patient or family. These conflicts can create an uncomfortable work environment for everyone.
What is conflict? Conflict is arguments, clash of opinions, incompatibility between interests that may potentially harm the main goal. Conflict typically occurs due to differences in personal agendas, perspective, or goals between the nurse and the patient or the nurse and the family. My conflict here happening in the intensive care unit when we taking care of a 90 years old male patient. He was admitted to the ICU with aspiration pneumonia, and his daughter, the primary caregiver, was present during this morning treatment. Tensions arose when the daughter was informed that she couldn't come and go freely as she wished because this is ICU and patients are vulnerable, having life-threatening condition, and the risk of infection is very high. So limiting visitors helps to minimize this infection risk. The daughter admit that a doctor whose name she didn't know allowed her to do so. As the nurse worked to manage patient condition, including administering levofet for low MAP and low blood pressure and adjusting oxygen levels to 100% FiO2. The daughter persistently questioned each treatment. Why you do this? Why you do that? Why my daddy need 100% oxygen? And why my dad need levofet? And in at home, he didn't even need that. And he was okay. And she always insisted on changing it to the way it was at home. Reason was that her dad can survive without it, like lowering the oxygen, using NG tube instead of PEG tube, despite the aspiration rest explained by the medical team. The tension peaked when I noticed issue with the patient's both IVs, and there's a swelling on the IV that run left of it, which may be an extravasation that risks for tissue necrosis. We discontinue both IV and attempt to insert two new IVs in an already constricted small vein. While we were doing it, the daughter repeatedly interrupted, asking this and that, demanding answers, leading to confrontation where she reported everything that we did and about that swelling to the doctor that just happened to walk in to start preparing for central line. The nurse stopped her and said that it is not your job to explain to the provider. It is my job because I am the nurse. And finally, my nurse asked her to leave. Leave now. Go out because you're disrupting the care process. My nurse raised the tension and also slammed the door. The daughter was so upset and then inquired about speaking with a patient advocate.
The statistic that you see here is a result when a conflict is not managed effectively. According to American Nurse Association report in 2023, 1 in 4 nurses per hour are assaulted in acute care setting. And the other consequences can happen is higher level of emotional exhaustion, practitioner burnout, and high turnover, reduced job satisfaction, and increased stress in the workplace. And the paramount consequences is poorer outcomes for patients. This is why we need to avoid the increasing tension as early as possible by learning conflict management. Conflict management strategies can improve the working environment and safeguard the well-being of both patients and healthcare professionals. So now let's define leadership. Leadership or nurse leader is defined by their action and not always by a position of authority or social standing. What kind of action that we talk about here? Leaders in nursing inspire people. They motivate their team. They also influence others to achieve their maximum potential. They maintain patient and staff satisfaction. They earn the team trust, and they influence a group of people or their team and co-worker, including patients and family, to achieve a common goal. Leadership styles play a crucial role in shaping the dynamics of healthcare teams and influencing patient care outcomes. One of the most well-known leadership styles is the traditional, the authoritarian or autocratic style, where decisions are made by the leader with little input from others. We can see here as illustration only the famous leader that is using this type of leadership. I can imagine him saying, "Do as I say, and no question asked," or "Missiles do the talks," that kind of style. This traditional autocratic style of leadership is characterized by a hierarchical position, like a king or business owner to the subordinates. It focuses only on the completion of administrative tasks. Among nurses, this is not a popular leadership style. Nurses had a negative perception because it focused only on the task or on the company benefit, but not on its people. This type of managers do not address the needs of the staff, and the nurses do not feel heard. Another traditional leadership styles are laissez-faire and democratic. Laissez-faire means allowed to do. Laissez-faire leadership is a hands-off approach where the leaders provide minimal guidance or minimal supervision and allow the team members to make decisions independently. This style encourages autonomy and can be effective in a highly skilled and motivated teams. But it may not work if the team is lack of professionalism or lack of experience. Democratic leadership is a collaborative approach where the leaders actively involve the team members in decision making and value their input. This style fosters a sense of ownership and teamwork, encouraging open communication between the leader and the team members and share responsibility in achieving the main goals. Contemporary leadership style. Contemporary leadership style emerged in between year 1960s to 1980s. It emphasized flexibility, adaptability, and collaboration, reflecting the dynamic and evolving needs of the new modern organizations. First, transformational leadership. Transformational leader type inspires and motivates the team to exceed expectations. He shared vision, influenced staff engagement, encouraged innovations, and fostering personal growth. The key traits is this leader visionary, inspirational, empathetic, and forward-thinking. We have seen a lot of examples in this modern world, such as Steve Jobs and Elon Musk. Second, servant leadership. Servant leader focuses on prioritizing the needs of others, empowering and support the employees to achieve collective success. The key traits empathy, humility, listening, stewardship, because this kind of leader believes that a leader is to serve. Third, situational leadership. This kind of leader involves adapting leadership styles based on the maturity and competence of the team members. This model emphasizes that the leaders must adjust their leadership style depending on the development level of the team members. The leader can be more directive if the team is inexperienced, and the leader can be more delegating if the team is capable enough. Last, transactional leadership. This kind of leader emphasizes structured tasks and rewards or punishment based on performance, aiming to maintain order and achieve specific goals. So, under this kind of leadership, the more accomplishment you make, the more rewards you get. Now let's go back to our conflict. It's about a nurse versus the patient's family that bothering at all time because she didn't have a good understanding of the therapy benefits and consequences. For this case, I choose to apply transformational leadership. Transformational leader motivates a problem-solving strategies and intellectual stimulation. The leaders focus in encouraging the team through communication, positive attitudes, and fostering trust. Sometimes during conflict and complaints, all the nurse wants are encouragement. This kind of leader is a good role model. They show how to do this and they inspire the team to further do the same for patient and family. For my conflict situation, rather than slamming the door and raise the voice tone to the family, a good reply for the nurse in this situation is something that goes like this. Mrs. M, I can tell that this situation is very stressful for you, and it is okay to feel overwhelmed. Right now, I need to be focused, and when I have downtime, let's sit down together and take a moment to break down how the therapy works and the positive outcomes it can bring for your loved one. I want you to feel empowered with the knowledge of how this will help your loved one recover, and together we can navigate through any uncertainties. How about that? I have three ways to propose to resolve my conflict. A. Actively teaching to the family so they can make informed decisions. Before the daughter talk too much and acting out, we as nurse must take the lead. Nurse need to take on the educator role and leader in this patient treatment plan. Use evidence-based facts to support the teaching. Provide explanation and help the family understand. Break down complex terms into simpler terms that they can understand. Use metaphors, visual, and practical examples to make it more digestible to the daughter. Building a rapport and earn the family trust is crucial. The nurse can establish trust by being transparent about the potential challenges in this therapy process. B. Involve family in the treatment plan. Explain what is the treatment plan in this shift to minimize repeated questions during the procedures. Explain that we will provide time for family to ask questions. As the therapy progresses, acknowledge and celebrate small improvements of the patients with the family. C. Be compassionate. Empathize with their concern about discomfort involved, explaining how the nurse will be there to monitor progress and adjust the plan as needed. As students, we can learn how to be a good leader too, and I would like to share the leadership best practices for nursing students. A. Acknowledge and validate others' feeling. Use active listening, empathy, and reassurance. Sometimes people choose to avoid patients, avoid conflicts. Don't do that. Don't ignore the patients. Don't run away as it won't solve the conflict. It probably will escalate the tension. Validate the patient's feelings. I've seen this practice make the difference on the floor. That way you are going to build trust, reduce their anxiety, and it will improve their whole experience. How you can do that? You can say, I see that you are upset about this and I understand your concern. Or, I can see that you are feeling anxious about the treatment and it's completely normal to feel this way. Second, you can foster open communication. Create a supportive environment that encourages active listening and honest conversation. Make sure you fully understand the situation. You can say, so what I'm hearing is that you feel this and that. It shows that you are engaged and open to resolving the issue. Third, maintaining the composure. Keep in mind to always maintain professional behavior in every situation. Stay calm, take a deep breath, keep your body language neutral, and speak in a steady and respectful tone. If needed, you can take a moment to collect yourself before responding to the patient. If you played the role in the conflict, admit it and apologize. Fourth, stay solution focused. Direct your attention toward finding a resolution rather than dwelling on the problem itself. The mindset will be on what we can do now in this situation. Find a common ground between you and them and collaborate to find a win-win solution. Offer possible solution. You can offer by saying, what do you think would help us move forward? That is all for the leadership presentation. We all can be a great nurse leader. It's hard to do, but it's not impossible. This is a reminder that nursing requires extraordinary commitment and resilience. Let me leave you with an anonymous quote. A good leader leads by example, showing empathy, building trust, and fostering an environment where every team member can succeed. Thank you.